So each tumor is its own experiment in evolution. So to me, this is a good reason to teach evolution in school, because we're not going to beat cancer unless we understand evolution. This is also why cancer therapy needs to be personalized. So the personalized cancer therapy first became a buzzword around the turn of the 21st century. The first incarnation of personalized treatment was targeted therapy. So targeted therapy begins with sequencing the DNA of the tumor, and the goal is to find driver mutations. So drivers are mutated proteins that give the cancer cell a growth advantage over normal cells. Drug companies have developed a battery of drugs to combat these different drivers. So knowing the driver in a patient's tumor, the clinician can administer a drug that blocks that particular driver. So this is personalized. So people with different drivers get different drugs. This is a survival chart. And in maroon, the top curve here shows a survival curve for targeted therapy compared to conventional therapy. So this shift to the right here means that the targeted therapy actually works for most patients and leads to prolonged survival. Okay? The problem is that the tumor continues to evolve, and it eventually develops resistance to that targeted therapy. And so the long-term survival on targeted therapy is really not that much better than conventional therapy. So the second incarnation of personalized cancer therapy is also shown on this chart, and that's shown in yellow, immunotherapy. Okay, so what's immunotherapy? Immunotherapy is activating the person's immune system to fight the tumor. Okay. The first wave of immunotherapy was something called checkpoint inhibitors. It turns out that your body is always getting rid of cancerous and precancerous cells. A tumor forms when those cancerous cells evolve a way to evade the immune system. Okay, and so one way they do that is by hijacking the immune system's checkpoint system. So what's the checkpoint system? So look at what happens when your body is fighting an infection. The immune system mounts a response, and there is a massive proliferation of white blood cells. Now, when the infection is eliminated, there needs to be a way to turn that proliferation off. And that's the function of the checkpoint system. So by hijacking the signaling system of the checkpoint system, the tumor essentially turns the immune system off in the vicinity of the tumor. Okay? And so checkpoint inhibitors are drugs that block those checkpoint signals. Now this is a double negative, so it can be confusing. Okay? So the checkpoint system puts the brakes on the immune system. Checkpoint inhibitors block the checkpoints, releasing the brakes. Okay? So now here, if you look at the yellow curve, this shows the generalized response to immunotherapy. So in fact, immunotherapy doesn't benefit most patients. But this shift up here shows that for a small percentage of patients, it actually leads to long-term survival. Okay? So the fact that this line is parallel to the x-axis means that these patients are essentially cured. So that's the excitement about immunotherapy, because it has cancer researchers actually talking about cures. Okay, so this is an insight from one of the leading researchers at the National Cancer Institute. And so when cancer is cured, it is the immune system that kills the last cancer cell. Okay, so this is important, right? Curing cancer means killing the last cell. Right? The immune system has the ability to adapt to an evolving tumor so it can actually kill the last cell. Okay, so as I said, the immunotherapy only works for a small percentage of patients. So the big focus in cancer research right now is how to make it work for more patients. So the immunotherapy that I work on with Dr. Kathy Wu is something called neoantigen vaccination. So neoantigen vaccination again begins with sequencing the tumor. The goal here is not just to identify driver mutations, but to identify all mutations that change proteins. So these mutated proteins are new to the body, and so they should be immunogenic. That means they should elicit an immune response. So because these mutated proteins are new and they're immunogenic, they're called neoantigens. Okay, so then in neoantigen vaccination, a vaccine is created that consists of bits of these mutated proteins called peptides. And so this peptide vaccine is then administered to patients in the hope of getting their immune system to now attack the tumor. So this is truly personalized therapy, right? The vaccine is made for only one patient, so it depends entirely on what the mutations are in that particular tumor. So each patient is getting a different vaccine. So this shows the first time that strategy was actually tried in humans. So the target in this case is melanoma. So if you start up here, you can see the steps of tumor procurement, and then the tumor was sequenced to identify tumor-specific mutations. Based on those mutations, a personalized vaccine was manufactured that consists of pools of peptides. And then these peptides are administered over a course of about 20 weeks. So this was a phase 1 study, so there were only 6 patients treated. So for the fourth stage 3 patients, the vaccine was administered, the cancer went away, and these people have been cancer-free ever since. For the 2 with stage 4 melanoma, the vaccine was administered, but then the cancer recurred soon after that. These 2 patients were then given anti-PD-1. This is one of the checkpoint inhibitor drugs. After that, the cancer again went away. That's what clinical response means, that the cancer went away. And they too have been cancer-free ever since. So this is clearly a very promising approach to fighting cancer. But it has the challenges of actually creating personalized vaccines. So it's sort of indicated by these stage 4 patients. The next step in cancer treatment are these combination therapies. And if you remember what Dr. Rosenberg said about killing the last cancer cell, then one component of that combination therapy, at least one component, needs to be immunotherapy. So this shows the hoped-for effect of doing combination therapy. In this case, the combination is combining immunotherapy with targeted therapy, right? And so the goal is to get benefit for all patients combined with long-term survival. Okay. So in terms of beating cancer, cancer has been cured, but only for a small percentage of patients. The real challenge now is how do we increase the success rate? So, thank you.